Hi, I'm Molly Resnick and welcome to another edition of Labriyut to Your Health. May 1st, 2008, Melbourne, Australia. It's a girl and the parents are thrilled with their new daughter. But within a few days, joy turns to horror as their new baby starts having multiple seizures every hour. Doctors diagnose the girl, we'll call her baby Z, with a rare disorder, molybdenum cofactor deficiency. She lacks the ability to metabolize the elevated levels of sulfite in her body. As the sulfite is slowly eating away at her brain, the baby faces a painful death within months. But her parents and the medical team at Monash Hospital in Melbourne refuse to give up. A German biologist, Dr. Gunther Schwartz, has worked with a possible remedy for 15 years, but he's only tested it on 20 lab mice. Yes, it cured the mice, but would it work for humans? The Monash Hospital head, pediatrician Dr. Alex Veldman, worries that the procedure carries too many risks. There was no precedent and no knowledge about side effects or dosage. But baby Z's condition was rapidly deteriorating. Her parents were determined to try anything. As Dr. Schwartz's entire stock of CPMP was airlifted on ice from Germany, a bioethics board was meeting in Melbourne's family court. Within 90 minutes of the court's approval, baby Z had her first injection. Most drugs that undergo animal testing never even make it to human testing. And if they do, it takes years. In this unique case, baby Z's medical team got the life-saving serum from the judge's bench to the patient's bedside in 2 weeks. But is it ethical to use humans as guinea pigs? Is it right to inject a baby with a drug that hasn't finished the testing phase? Perhaps it would be more moral to let nature take its course. We polled some parents in Times Square.
If it was my child, I would use an experimental treatment if that was the only treatment available and the child's life was in jeopardy due to the disease.
For myself, I would, but if I was making the decision for a child, that's a different story.
I have grave concerns about a parent choosing for a child, the reason being the child then needs to live with the consequences, which might be some severe reaction in some way.
I mean, if it was our child that was dying and they tried everything else, there was no other solution, and there was even the slightest possibility that it could help them and they could live, then I would say, why not?
Yes, parents in the throes of desperation will try anything that might give their child a chance of survival. But is this the moral and ethical course of action? We turn now to our panel of experts, Dr. Reichman and Rabbi Pink. Dr. Edward Reichman is a professor of emergency medicine, philosophy and history, and a renowned Jewish medical ethicist.
The greatest advances in medicine have occurred as a result of human experimentation. Human experimentation is essential for us to understand how procedures work. However, human beings need to be protected in the course of this experimentation. And in fact, many of the ethics that have been established for human experimentation are based on the Nuremberg laws, which evolved after World War II. Having said that, there may be cases when human experimentation may be allowed even in risky circumstances if it is deemed that the benefit outweighs the risk in a specific case.
For the halachic perspective, we turn to Rabbi Pink.
With regards to carrying out clinical trials on the child, as long as the child will benefit from the results of the experiment and will not suffer any significant pain, then one may carry out the experiment. However, if the child will not benefit personally, he may not be involved in the experiment. If there is a small element of risk attached, as long as it is minor compared to the potential benefit to the child, then it is permitted to carry out the treatment, as every treatment has an element of risk attached to it. However, if there is a high level of risk, then it may not be trialed on a child. If a child is in a life-threatening situation, one may try a risky experimental treatment if without the treatment, the child will definitely die, and the treatment offers a chance, even slight, of recovery.
And baby Z, just hours after the first injection, Her sulfite levels dropped by more than 2/3. Within 3 days, they reached normal levels, and she woke up from her comatose state. Baby Z is the first person in history to be cured of this disease. Now an infant in Germany has also been saved. And while both children will always need a daily injection of CPMP, they have the rest of their lives ahead of them. I'm Molly Resnick, and thank you for joining us for this edition of Labriyut to your health.